Thanks for tuning in to the Women's Vibrancy Code, a podcast dedicated to helping women move from exhausted to energized, balance their hormones, and feeling turned on by their life, their lover, and themselves. I'm your host, Maraya Brown. I'm a Yale and functional medicine trained women's health expert, midwife, mom, keynote speaker, and self-made entrepreneur. I'm the founder of my signature program, the Women's Vibrancy Code. So sit back, relax, and let's chat about your energy, hormones, libido, and embracing your feminine power. Oh, and you might want to have pen and paper to take some notes on some of these episodes. Hello, everybody. Maraya Brown here. I always pay attention when there's questions that come up over and over from women, either in social media or responding to past podcasts or clients of mine, when I'm seeing a theme. And this week, there has definitely been a theme around low estrogen. And so symptoms such as vaginal dryness, brain fog, moodiness, irritability, brittle bones, tender breasts, dry skin, hot flashes, night sweats, irregular menstrual cycles, no menstrual cycle at all. And, I talk a lot about estrogen dominance, and we definitely don't want estrogen dominance. But I realize I haven't really spoken to the women who are struggling with low estrogen. In the context of this conversation, when we're talking about low estrogen, generally the first place that you think is hormone replacement therapy. And so if you're seeing a mainstream provider or even alternative providers, your naturopaths, your functional medicine providers, hormone replacement therapy, bioidentical hormone replacement therapy, body identical hormone replacement therapy is definitely one of those things that is worth a conversation or talking about. It's not necessarily what I'm going to talk about today. That doesn't mean I'm opposed to it. But I think sometimes we're so accustomed to looking for the next quick fix, the next prescription. It's like, well, what about looking under the hood? Why is the estrogen low in the first place? Okay. And have you tried the lifestyle modifications, diet modifications, supplementation modifications, potentially before going on to hormone replacement therapy or in conjunction with, specifically on this topic of low estrogen? And so I say that most of the women come into my space, they're really wanting a more holistic approach. They want to look under the hood, get to a foundational cause, and feel better, but not just what is my next pill. Okay, so let's talk about low estrogen. So who is the woman that I'm speaking to? This is the woman who is struggling with hot flashes, struggling with vaginal dryness, a decrease in libido, trouble concentrating. And often estrogen will start to go down around age 35. But I definitely meet women where age 40, they're already in full menopause. Menopause is something that is a non-negotiable. Okay, if you are a female-bodied individual, you were born as a female, you will at some point go through menopause, right? The ovaries start slowing down and we go into a next chapter of our life. And depending on your lifestyle and your choices, you can have a very different experience of it. Average age of menopause is 51 and a half. Definition of menopause is once you've gone 12 months without a menstrual bleed. But what happens for some women around age 35, plus or minus, estrogen levels start to go down. And so women will come in, they're saying, my skin feels dry and brittle. My breast tenderness is up. I've been diagnosed with weak or brittle bones. I've been diagnosed with osteopenia or osteoporosis. I'm having a really hard time concentrating. The words don't come as easily. I'm forgetful. I just don't feel like my mind is as crisp and clean as before. Like I said, moodiness, increased irritability, more pronounced PMS, where you're like, wow, I'm losing my patience with my children. I'm not as patient with my friends. My moods seem to swing like the pendulum. I'm sad, and then I'm anxious, and then I'm angry, and I'm irritable, and I'm going, what is going on here? And then, like I said, the hot flashes, the night sweats, the vaginal dryness, as well as irregular periods or no periods at all, otherwise known as amenorrhea. So why is this happening? Well, generally what I want you to know is I talk a lot about adrenal well-being. Okay, there's something called your HPA axis, your hypothalamic pituitary adrenal axis. Hypothalamus, pituitary, adrenals. They are like a tight-knit team. They are in constant communication with one another. Okay. There's also the HPO axis, the hypothalamic pituitary ovarian axis. They're in constant communication. The pituitary communicates directly with our ovaries and directly with our thyroid. Okay. Hopefully I haven't lost you. Hopefully you can see a visual. Like I'm seeing hypothalamus, pituitary, adrenals, all connected. And then the pituitary is communicating directly to the ovaries and our thyroid. So often, along with low estrogen, often comes a sluggish thyroid. Often comes the adrenals being tired. The adrenals are that place of fight, flight, or freeze. Okay. So everything is connected. Okay. We also can't disregard our gut microbiome. Sometimes there can be something going on with your gut that is impacting your body's production of estrogen. And with that being said, the ovaries are the main source of our estrogen production. Okay, during our fertility years, it's specifically estradiol. And so as the ovaries start to slow down a little bit, then there's less production of that estrogen. Okay, then the adrenals get the knock on the door to potentially make up the brunt of it. And come on, help us out, give us some of that estrogen. But if our adrenals are tired, we've been overdoing it, overworking, not setting boundaries, not taking a pause, not filling up our own cup, overworking, overdoing, then the adrenals are tired. Stress has been too much. And then now we have more pronounced low estrogen. And so a woman will come into my space complaining of one or many of these symptoms. And so a mainstream provider will often say, well, it's just part of aging. Here's some hormone replacement therapy. Okay, well, yes, on one hand, it is part of aging that our ovaries slow down, estradiol goes down, and instead estrone, which is a different kind of estrogen, comes up. That doesn't mean beyond menopause you have no hormones, though. That doesn't mean that you have no estrogen, okay? There's different ways that we want to support your body in producing it, okay? There's different ways that we want to make sure to support your body foundationally. Sometimes that might include some bioidentical hormone replacement therapy. But I want you to know that it's all really related. So why? Well, maybe there's a gut dysbiosis. Maybe there's been too much stress and your adrenals are tired. Maybe your ovaries are slowing down. Maybe there's something else going on where your cholesterol is too low. Okay, I want you to know that cholesterol is not all bad. Okay, cholesterol converts into our hormones and it goes through a specific cascade. Okay, so maybe our cholesterol is too low. Maybe we're not getting enough quality fats. Maybe the conversion from pregnenolone, and I'm not going to get into the conversion chart, but how cholesterol converts to something, which converts to something, turns into estrogen. Maybe there's something going on with that conversion. Okay. But I also want to say, I talk a lot about estrogen dominance, for the woman who's having really painful periods, also can be pronounced irritability, high PMS, fibroids, risk factors for estrogen-dependent cancers, right? So we don't want really high estrogen. We also don't want really low estrogen. And sometimes it's not just your total estrogen level, but your estrogen in relationship to progesterone, okay? Which is one of the reasons why, as I record this in December of 2022, I think the best test on the marketplace that we have access to is the Dutch test, which is looking at both your estrogen and your progesterone through dried urine. It shows us total amounts. It also shows how those hormones are metabolized out of the body, including your testosterone. And then I can also look at your adrenals So just keep in mind, we don't want to swing the pendulum too far in either direction, but there's a lot that can be done to specifically address these symptoms that this week I've had so many women coming to me asking about. Okay. So let's talk about some solutions. First, lifestyle. Okay. So we need better sleep and we need to honor our circadian as well as infradian rhythms. Okay. What does that mean? When we sleep, that's when we get to rest and restore. Okay, that's when the body gets the nervous system unwinding, gets to be feeling safe. It's the time when we produce a lot of testosterone and we get to rest and restore. Okay, and part of helping to get good sleep is really honoring your circadian rhythms, your 24-hour rhythms. So waking up in the morning, first thing, get sunlight on your eyes. Open the blinds, find a window. Can you even get outside for just 5 minutes? Let the sun touch your eyes. I was listening to a podcast and she goes outside in the snow. I'm like, oh my gosh, I don't like to be cold. In Hawaii, that's easy. And then watching your eyes exposure to blue light. So the kind of fake lighting that we have in our homes from electricity and LED lights, the blue light that's coming from my computer that I'm looking at right now. Even though I have a blue light blocker, even though I have my blue light blocking sunglasses, which are in the drawer and I don't have on right now, I have a timer on my cell phone where it's set so that the blue light blocking turns on from 7 p.m. to 7 a.m. automatically. Okay, so I'm reducing my eyes' exposure to blue light, which is, yes, it's actually going to support your circadian rhythm. When our circadian rhythm is supported, our nervous system is supported and our foundational hormonal well-being is supported, okay? So lifestyle, we also want to practice stress reduction, okay? Remember how I said there's this HPA axis that's a tight-knit team and the pituitary is communicating directly to the ovaries, but the pituitary is that tight-knit team with the adrenals. So if your stress level is consistently too high, and you're that type A, go, 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 do, exist in that masculine push energy, let the news playing in the background, eating pro-inflammatory foods, too much caffeine, too much alcohol, not setting boundaries with toxic people, not taking pauses for breath and body movement and good hydration, all of that is causing stress, which then will impact how the pituitary communicates with the ovaries. It's also going to communicate with how the pituitary is communicating with the thyroid, which I think is fascinating why so many women will come to me and they have hypothyroidism and adrenal fatigue. So from a lifestyle perspective, all of that, okay? From a diet perspective, what do we do to support healthy estrogen levels? I've had a number of women say, okay, other than hormone replacement therapy, everybody's always giving me a prescription for bioidentical hormones. What else can I do other than going directly to hormone replacement therapy? You can eat a diet rich in phytoestrogens. Phyto meaning plant. Okay, so estrogens that come from plants. I love Dr. Christiane Northrup. I've followed her for decades. Women's Bodies, Women's Wisdom. What is it? I have it right here on my shelf. The Wisdom of Menopause. And I really appreciate the research that she's done as an OBGYN. And one of the things I hear from her loud and clear is that phytoestrogens, the beauty of them is if your estrogen is low and you increase phytoestrogens, it will bring the estrogen up. If your estrogen is too high and you increase a diet rich in phytoestrogens, your estrogen will come down. Phytoestrogens are also targeting a different estrogen receptor. I'm not going to get into that, but just know that I have people come to me having concern of phytoestrogens and breast cancer risk. I don't have those concerns because it's a very different estrogen receptor that the people that I follow, the research that I have read is that it's actually protective against breast cancer. So what are foods that are high in phytoestrogens? Well, phytoplant. So for those of you that are eating a plant-rich diet, I'm proud of you. Good job. That doesn't mean that you need to be vegetarian or vegan. I'm not opposed to it. I do think that women in particular need ample protein though. But so eating a diet rich in plants and specifically ground flax is a great thing to add in every day. Make sure it's organic. Make sure you store it in the refrigerator and make sure it's ground. It's a great source of fiber to support your gut well-being and get your bowels going so that you have great detoxification. It's also a great source of phytoestrogens. From a supplementing standpoint, primrose oil is a nice supplement that you can add in. Red clover tea and soy. So a nice organic non-GMO soy, I'm a big fan of. So your miso soup, your tempeh, organic non-GMO soy milk, tofu. And some people are like, no, soy is all bad. Listen, if you're someone that your body really doesn't handle soy, and like for me, my body really doesn't handle cow dairy or gluten. I feel like crap after I eat it. Okay. If you feel like crap after you have quality soy, then I'm not suggesting that for you. But a lot of people have like labeled soy as all bad. I think that it's not necessarily soy that is so bad. It's the genetic modification, pesticide and herbicide filled soy. So as long as you are getting a quality source of soy, I'm a big fan. That does not mean go get an encapsulated supplemental isoflavonoid or soy. That's not what I'm talking about. I'm talking about food here, okay? And the other thing is nice, healthy, quality fats. So once again, our foundational healthy cholesterol and healthy fats are going to support healthy hormone production. So your olive oils, your avocados, your nuts, your seeds, your coconut oil, I think you get the picture. Your MCT oil, that's going to be really supportive for healthy estrogen production. Okay. From a supplementation perspective, I already mentioned primrose oil. You can also, I did on episode 15 in the Women's Vibrancy Code podcast, you can go back and listen to that. I did specifically on DHEA. DHEA is an androgen that comes from the adrenals as a hormone precursor. What does that mean? Androgen. Androgen is like testosterone is also an androgen. Fascinating, right? Adrenal, meaning DHEA comes from the adrenals. So does cortisol. Cortisol is the main hormone that we think of in that fight, flight, or freeze response, right? So DHEA comes from our adrenals and it's a hormone precursor, meaning it's not actually a hormone, but it converts into a hormone. So DHEA turns into progesterone a little bit, but predominantly estrogen and testosterone. And so you can get it in supplemental form. I mean, obviously, I'm not suggesting that you just willy-nilly go at it. My preference is that you have a Dutch test first and you have someone that's really proficient and knows that test, knows how to read it, but has actually looked at your estrogen and your testosterone levels. But if you add in, like starting with a 5 milligram oral DHEA, or specifically for vaginal dryness, you can get DHEA vaginal suppository. Now that's being converted to estrogen and testosterone and can be lovely orally for stamina, immune health, energy, all of these symptoms I'm speaking of with estrogen that's low, as well as the symptoms that are associated with low testosterone, such as low libido, low energy, low confidence, low muscle tone, all of that, okay? So like I said, DHEA can be in oral form or as a vaginal suppository. Another supplement, and I'm just going to talk about 2 more supplements, and then I'm going to finish this up. This is a nice quick podcast or Facebook Live, depending on where you're listening or watching. The other supplement is called Pueraria mirifica, Pueria. Pueraria mirifica, mirifica, mirifica. Pueraria mirifica is a supplement that you can get that helps support healthy estrogen levels. So specifically for that woman in your 40s, if you're struggling with some of the symptoms of estrogen depletion that I've mentioned, right now I'm supplementing with both DHEA and Pueraria mirifica. I'm 45. my progesterone and, well, I guess my estrogen wasn't necessarily low, but it also wasn't high. But I started experiencing some of the symptoms. My menstrual cycle was getting a little bit shorter. I was noticing some spotting before I was bleeding. I was noticing a little bit of just less crispness in my brain clarity, a little bit more moodiness around PMS time, specifically my fall time. So I added in supplemental DHEA orally at a 5 milligram, as well as Pueraria mirifica. And wow, it's striking. Notice a change in increased libido, notice a change in increased energy, more brain clarity, reduction in irritability. As long as I remember to take it, there was a couple months where I was traveling so much and life was so full and I was forgetting. And I definitely noticed a difference. And the last thing I want to talk about is called adaptogens. Anyone in my space hears me talk about adaptogens a lot. I want all of you to be drinking adaptogen elixirs every day. You can take supplemental adaptogens. So what are adaptogens? They all come from the plant mushroom botanical kingdom, mainly from mushrooms. They help the body better adapt to stress. Okay. Each adaptogen kind of has a different quality to it. You can't really go wrong. They just go in and help the body. I mean, chaga and reishi are well known for immune health. Shatavari and ashwagandha are known for energy and juiciness and thyroid support and blood sugar management. Dark chocolate, green tea, cordyceps is great for stamina. Lion's mane is great for brain clarity and crispness, right? And so when I say I want you to drink an adaptogen elixir, first, I'm going to put in the show notes the link to download my free adaptogen elixir recipes. But the thing to know is there's 3 main components to an adaptogen elixir. You have your adaptogen, you have your protein source, and you have your fat source. Okay? Then you're going to add your hot water, your nut milk to taste, any other spices, any other sweetener to taste. So adaptogens. 4-Sigmatic, Rasa, Anima Mundi. Those are 3 of some of my favorite brands. If you're going to be adding them to your adaptogen elixirs, 4-Sigmatic and Anima Mundi are powders. They just dissolve right in the water. 4-Sigmatic, on the other hand, is loose leaf, so you do need to steep it. Okay, so there's some sources of your adaptogen. Then your protein source. I use collagen powder. You can also use a vegan plant-based protein powder if you'd like. There's different ways to get in some protein. Then your fat source. I will usually use MCT oil or CBD oil. You can also use olive oil, avocado oil, coconut oil. And then you add your hot water. If you want to emulsify it, I get one of those little handheld, for those of you listening in the podcast, I have my hand up. It's like this little wand with the spinning round thing on the bottom and the button on the top. You just push the button and then it spins it and emulsifies it. So now the fat doesn't separate from the liquid if that texture bothers you. And then I'll add in some nut milk to taste. You'll find the nut milk that's your favorite. I like Nut Pod and I like the organic soy milk from Costco. Those are my 2 favorites. And then add your sweetener to taste. I usually will do monk fruit drops or stevia drops. Maybe you prefer honey and your blood sugars can handle that. You'll find your way. And then you can add other things that are going to add some value. Maybe you want to add some maca powder as a way to help support your testosterone and a little bit of estrogen. Maybe you want to add some Dandy Blend to give that like kind of coffee kind of flavor, real earthy, kind of bitter. It's also a great source of prebiotics and dandelion roots, so really good for your liver. Maybe you want to add some cinnamon and ginger and turmeric to make like a chai flavor. Right? You'll play around with it. Grab the free adaptogen elixir recipes and you can play around with it. And what I want is for it to be an enjoyable experience. So I actually am just finishing mine for the day. I made this pot and I've been sipping on it all morning. Okay. And so then it's like yummy. I just took a sip. It's yummy. It tastes good. It's like going and getting that $6 latte at Starbucks, but I'm not spending the $6. And instead it's really fueling and serving my body and helping the body better adapt to stress. The other thing just to add with adaptogens, in addition to doing your adaptogen elixirs each day, is you can get them in tincture form and encapsulated form. I keep cordyceps and lion's mane encapsulated here in my office in my drawer. I do the Stamets brand. I love Paul Stamets. Such a legend in the realm of, mycology. And so I'll keep those here. And if I'm ever noticing, especially if I'm on Zoom call after Zoom call or just like working for more hours than I would like to admit, and I'm noticing that my brain clarity is a little bit lacking, obviously I'll get up, I'll move my body, I'll do a 7-minute workout, do a loop around the block, get some fresh air, hydrate better, add some green powder into my water, make sure I'm getting some quality protein, fat, and fiber, all of that stuff. But then on top of that, I'll take a round of encapsulated cordyceps and lion's mane. So now that's giving me stamina from the cordyceps and focus and brain clarity from the lion's mane. And it's lovely because it's going to give me that boost that I'm wanting to really stay focused and keep the stamina without the coffee buzz or the jitters. And it goes in and just serves my adrenals. Okay, so the other thing specifically with the vaginal dryness, let me just speak to that. I did do a whole nother podcast episode just on vaginal dryness. I encourage you to watch, to listen to it. But just keep in mind, we want to bring up that estrogen level. You want to hydrate well, increase your omega-rich foods, your quality fats. And then for some women, you might want to consider adding an additional Reverie, which is hyaluronic acid in suppository form that's vaginal. For some women, maybe the O shot is helpful. I mean, there's a lot of different routes to take. And then there's obviously going to hormone replacement therapy. It's not all bad. I'm not there. I have not added hormone replacement therapy for myself. I'm not totally closed to the idea as I progress through my later 40s and into my 50s. Maybe I will. If I do, I will make sure that it's bioidentical, that I'm adding progesterone, not a progestin. I don't want it coming from horse urine. And I'll keep the dose really low. I'm a strong no for pellets. And I'm not going to get into that right now, but I don't want something going into my body that I can't reverse. Okay. So like the Depo shot, the pellets, they're not the same category, but in either one, once it's in your body, you've just got yourself 3 months of what if you don't like it? What if it doesn't work well? What if the dose is wrong? So my preference is that if you're going to take the hormone replacement therapy route, that you start small, okay? You can start with like a compounded cream that's a mixture of estradiol, estrone, testosterone, progesterone, and DHEA as an example, and just put a little bit on each day. Or maybe you'll start with just progesterone and you'll just take that in capsule form in the evening before bed. It's going to help with sleep and support so much, okay? If it's just the symptoms of vaginal dryness and the atrophy, maybe you'll start with just some bioidentical vaginal cream that you'll put on each day, right? There's lots of different routes. So hopefully whatever provider you're seeing, they're not just saying, here's a antidepressant. So silly. So some will just go, it's an SSRI, a selective serotonin reuptake inhibitor. Here's your antidepressant, and that's going to take away your hot flashes. It's like, well, is that really that's not my solution. I'll say that right now. There are so many other things that you can do. Or, here's a standard pharmaceutical hormone replacement therapy. I think that there's other better routes. And when we're adding in those extra hormones, great. There's benefits to that. It's going to keep your bones strong and your mind clear and keep the proliferative byproduct of estrogen really solid and your vaginal tissue and your libido rocking, through your 50s, 60s, 70s and beyond. We want all of that, okay? And for the woman who's having the irregular menstrual cycle, maybe we just need to make little adjustments to really make your menstrual cycle a little bit more consistent and healthy, right? And so obviously for those of you that are listening, I'm not your provider, but I do work directly with women online all over the world. There's different routes that you can come into my space. First start would just be to email successadvisor@marayabrown.com. I want you to know that there's lots and lots of solutions. And we're all here to help you and to support you along your way, whether it's a self-paced membership or you want to do a deep dive mastermind group setting that includes testing and me and master coaches, or you want more of like the big VIP experience. For the VIP experience is really an application process and only for very select few that are the ambitious women in the world that have the big ripple effect. They want all one-on-one hand holding. I offer a lot of my time, and that requires considerable investment of your energy, your money, and your belief in me, because I dedicate a lot to you in that VIP experience. And then plus there's in-person retreats and all the stuff. So hopefully this has been helpful with that. For those of you that have been having questions around low estrogen, hopefully you have some answers. Would love to hear from you. Yes, of course. Give a review in the podcast. And for those of you listening in Facebook world, you're welcome to ask questions below. I'll come chime back in on occasion. And with that, happy holidays, happy Hanukkah, Merry Christmas. As you approach into the new year, may this end of the year be spectacular and vibrant, and may you really look back with eyes of gratitude to look at the year that's passed and all the amazing things that have happened, the lessons that you've learned, the friendships that have been cultivated, and the things that you have learned to let go of as well. And may 2023 just be an absolutely spectacular year for you, where you can achieve the goals that you're wanting and feel the ways that you're wanting to feel in your body and feel connected in the relationships and the way that you really want to feel connected. And of course, may you feel turned on by your life, your lover, and yourself. Big thanks to each and every one of you. Thanks for listening to the show today. I know you have lots of choices and live a very productive life, as we all do. I appreciate that you've allowed me to dive deep in your journey of feeling turned on by your life, your lover, and yourself. I trust you learned something, expanded your self-reflection, and you're grateful we shared this time together. Connect with me at www.thewomensvibrancycode.com or on all social media platforms and YouTube by searching for Maraya Brown, Maraya Brown. Lastly, if you've found value in what we chatted about in this episode, please consider leaving me a rating and review on your podcast platform of choice. It helps others discover the podcast and get a feeling for the wonderful community we've all created together. As for now, I'm Maraya Brown, and you've been listening to the Women's Vibrancy Code.